Good afternoon and good morning to anyone joining us from west of the US Capitol. My name is Alan Cockle. I'm Senior Vice President for Public Policy with Civica, and it is my pleasure to welcome you today to a briefing on Civica's announcement that it will manufacture and distribute affordable insulin. I'll be moderating today's briefing, and shortly I'll introduce four excellent panelists. But just first, a few housekeeping notes. We will take questions from the audience after brief remarks from the panelists. You can submit a question at any time using the chat feature on Zoom. Just open the chat box and send us your question. We'll get to as many of those as we can. Also, please note that today's conversation is on the record and it's being recorded, and we will send out links to the recording and additional information after the event. By way of quick background, Civica is a nonprofit generic drug company. We were created in 2018 by a group of US health systems and 3 philanthropies who came together in response to a specific challenge, which was the problem of chronic shortages of essential medicines. Civica was established to supply quality medicines at fair prices and to improve the resiliency of the supply chain. Today, Civica serves 55 health systems, accounting for more than a third of the hospital beds in this country. We have shipped 70 million vials or syringes of medication that have been used to treat about 30 million patients. And we've expanded our mission with an initiative called Civica Script that has been established in partnership with 18 Blue Cross Blue Shield plans and the Blue Cross Blue Shield Association, and now also includes Anthem. And the mission of Civica Script is to bring down prices for consumers at the pharmacy counter. We'll say more about both of these organizations today, but the last thing I'll do is say that the guiding principle of Civica, its mantra, its policy 0.0, is to do what is in the best interest of patients. And that brings us to insulin. We have 4 excellent panelists who bring a range of perspectives on the challenges of insulin affordability. And I'll let them speak to that and in more detail to the Civica Insulin Initiative. But just briefly, we have announced that Civica will manufacture and distribute 3 insulin products, insulin Glargine, Lispro, and Aspart, corresponding to the brand name insulins Lantus, Humalog, and Novolog. And once these are approved by the FDA, and we're targeting early 2024, these will be available to people with diabetes as interchangeable products in both vials and pen cartridges at prices that are significantly lower than insulins currently on the market, and will ensure that the benefits of our affordable price are passed all the way along to patients at the pharmacy counter. So now let me move to our panelists. We have 4 panelists, Natalie Stanback, who brings a personal perspective on insulin and diabetes, Dan Liljenquist, who is Civica's board chair, Aaron Kowalski, the CEO of JDRF, both a leading organization in the fight against diabetes and one of multiple funders contributing to this effort, and Martin Van Trieste, Civica's president and CEO. So let's begin with Natalie Stanback. Ms. Stanback is based in North Texas. She is a longtime advocate for people with diabetes. She and her husband, former NFL wide receiver Isaiah Stanback, are parents to a daughter with type 1 diabetes. And Natalie has other family members who have been affected, prompting her to become an advocate and fundraiser. So Natalie, welcome and thank you for being here.
Thank you very much, appreciate it. So just to share a little bit of how diabetes is for me and my family. For a lot of people, type 1 diabetes appears as a surprise. They don't know anyone else in their family who has had it. But for me and my family, there is a genetic factor. And the earliest known case of type 1 diabetes appeared in my grandmother's uncle, who was diagnosed in the early 20s and died in his early 20s after having his leg amputated. I know insulin was discovered around that time, but given his race and given the time in which he was diagnosed, insulin was simply not an option for him. And so there's no real surprise as to why he didn't do well. My uncle, my father's brother, was diagnosed at the age of 16. He succumbed to the disease about a decade ago. And my brother, more recently, who was diagnosed at the age of 9, passed away, unfortunately, 2 years ago. My daughter, who is now 9 years old, was diagnosed at the age of 3. So type 1 diabetes is a reality for my family, but insulin is also a reality for my family, and it is a reality that brings me immense distress. When my daughter was diagnosed, of course, there is the fear and the anxiety that comes with dosing via syringe, with applying the various technology pieces such as CGMs and insulin pumps. But what really kept me up at night was, what if we ran out of insulin? What if we didn't have insulin? Because she simply can't survive without it. It's not something where we could just manage her food intake and prolong her life without insulin. There aren't any other options or pills or anything like that. She has to have insulin. So there were many nights, and there still are many nights, that I'm left awake wondering, like, what do I do? How do we stockpile? Can we stockpile? Can we afford to stockpile? With the recent pandemic, I did lose my job, and my job is the means by which we have insurance that allows us to acquire our insulin. But there was a situation where I had to find another job immediately, or else we would not have been able to afford to pay out of pocket for insulin. That is a true fear, a true reality for me. I think about people in countries like Ukraine, who, they've got children and they have no insulin. They're running for their lives and their safety. And insulin is just not not having it. It's not an option. It's a commodity. And so it's just one of the biggest issues, biggest fears for me is that where we're going to get it from, how much it's going to cost. There are situations where our insurance might change, and because our insurance changes, the type of insulin we use that we prefer changes, and we don't have a say because it just costs too much to pay out of pocket. We have to go with what our insurance says is best for our kid, or what they choose to cover. And so that all reigns really heavily on me. My brother, unfortunately, he has passed away, but he went through periods between work, especially after falling off of my parents' insurance, where he had to ration his insulin. He would just take his long-acting insulin, and his fast-acting insulin he would take very sparingly because he couldn't afford to keep up with it. Of course, that was extremely detrimental to his health, and he fell victim to a lot of the side effects that eventually took his life that are related to type 1 diabetes. So for us, for my family, for my daughter, insulin is not an option. Having it is not an option. And so access to it is probably my number one priority as a parent.
Natalie, thank you. Let me go now to Dan Liljenquist. Dan is the Senior Vice President and Chief Strategy Officer for Intermountain Healthcare. He's also the lead architect and board chair of Civica, and someone who also has a personal connection to diabetes and has been the driving force behind the Civica Insulin Initiative. Dan.
Thank you, Alan, and thank you, Natalie. We're doing this for you, for people like you. When I was 10 years old, my parents adopted a set of twins from Colorado foster care. My father's an endocrinologist. He's a diabetes specialist. And these two little boys we adopted both developed type 1 diabetes, one at age 1.5 or 18 months, the other at 2 years. And they came with a host of other problems, including fetal alcohol syndrome and other developmental and cognitive delays. And these two little boys were they share my birthday, so July 10th. And so they became my roommates, and it was me and those two boys. And it was me in the middle of the night listening to see if they were still breathing and working to kind of make sure that when they entered a hypoglycemic shock or had another issue, that I was waking up my parents and trying to address it. So I've lived with diabetes, in my life and in my family's life for a long time. And later, one of my biological brothers developed type 1 diabetes as well. So I've seen it. I've seen the burden of this disease. And when this idea of forming Civica came to mind almost 5.5 years ago, this was one of the first drugs. I think it was the first drug that I wanted to make, making sure that we could bring insulin, make sure it was affordable for regular people. And it's a dream come true to see this announcement last week, Alan. We intend to make essentially generic, high quality, generic versions of Humalog, Novolog, and Lantus. Martin will speak about that process in just a minute. But those three molecules represent about 80% of the insulin prescriptions in this country. And our goal with Civica is to democratize insulin. These molecules, these formulas are clearly past their patented life. And our intention is to make sure that they enter the public domain within reach of everybody who needs them. The model with Civica is we're a non-stock, nonprofit corporation. Nobody owns Civica. I'm the volunteer board chair, and we have a team of professionals who work for the company. And again, as we mentioned, we've delivered on our promise so far. What's important to note is that in this model, we will charge a fully transparent price. We will not participate in rebates. Our goal is to bring the most sustainable price to the market and to make sure that patients, regardless of which insurance they carry, have access to insulins. One of the great travesties of the existing structure of the market today is that the list price of insulin has gone up by more than 11% a year for the last 20 years. And what happens is people like Natalie's brother, who are not insured, end up paying the highest cost. And when you don't have insulin and your blood sugars stay high, that's how you develop the 5 major complications of diabetes: heart disease, stroke, kidney failure, peripheral neuropathy that leads to amputations, and blindness. And those are very real and devastating consequences of poorly managed blood sugar, which diabetes or insulin is the key factor in sustaining life for these people. So our intention is to democratize insulin, to put it within the reach of regular people. We also intend to be the first drug company ever, to our knowledge, to actually publish on our packaging what we think a fair market price is. When you're dealing with retail and online pharmacies, we expect them to make a reasonable markup, but oftentimes that final pricing decision is left up to other factors than the manufacturer. And we intend as a company to make sure that our price is transparent and fair, and that we're signaling very clearly to the people who actually pay the cost of insulin, to the patients, what a fair price is. So again, as we mentioned, we'll bring insulin to the market beginning in 2024. And just really appreciate your interest in this really important subject for our country.
Dan, thank you very much. Let me next go to Aaron Kowalski. Dr. Kowalski is with us today as the CEO of JDRF, which is a global leader in type 1 diabetes research and advocacy. But he's also with us as a representative of one of the 25 organizations that have come together to contribute funding to make this initiative possible. Over more than 35 years, Dr. Kowalski has been an internationally recognized scientific expert on diabetes research, and he's led the transformation of JDRF as a global organization funding T1D research. And he also lives with diabetes. Dr. Kowalski.
Thank you, and it's a real honor to be with this incredible panel. As CEO of JDRF and someone who's lived with type 1 for nearly 4 decades, and I also have a brother who's lived with type 1 for over 40 years, I'm so proud to be joining with Civica and our partners to combat this insulin affordability crisis. As I listen to these stories, Dan, Natalie, my blood boils. I can't stress enough the impact of this problem, and Natalie's point that type 1 diabetes is a universally fatal disease without insulin. Take away my insulin and I could be dead in a week. Same with my brother, same with Dan's brother and Natalie's daughter. And we have 1.6 million people in the United States who have type 1 diabetes and 7 million people on insulin. This is a national crisis. So every day I hear from our community stories like Natalie's. I hear from people who've skipped their insulin doses. I mean, this has tremendous individual cost, but for all the members in Congress, this has a cost to Medicare and our national budget. As Dan described, the incredible burden that reduction of insulin places on people drives diabetes complications. I've heard from people who've changed jobs. In fact, my brother's wife, just like Natalie described, changed jobs to ensure they had access to insulin because they were on a high deductible plan and it was unaffordable, and he has a great job. It's just shocking. I hear from people who worry about their children who are turning 26 and going to come off their parents' plans. People who travel to Canada to buy their insulin. The cost of insulin in the United States is too high for many Americans. And this really impacts, as Natalie pointed out, people who are underinsured or uninsured. So this rationing of insulin is an unacceptable consequence, and it's leading to devastating repercussions, including people who die. So JDRF and the diabetes community have been advocating with decision makers in government and the private sector for years. We've made progress, and we support proposals in Congress to limit out-of-pocket costs in Medicare and commercial plans. That said, we believe this Civica project is a huge step forward. Civica, as Dan pointed out, will manufacture insulin at a low, transparent price of no more than $30 a vial for everyone, whether they have insurance or not. I mean, this is transformative. This is a tenth of the cost of current list price insulin right now. So as Dan pointed out, again, these are insulins that we use, I use, my brother uses, Lantus, Humalog, and Novolog biosimilars, and using the existing pathways at FDA, which we're so relieved that exist. So again, at JDRF, we're really honored to be part of this amazing team of partners representing leading health systems, diabetes organizations, and philanthropists. Our goal is to ensure everyone in America can afford their insulin while we work to advance for cures for type 1 diabetes. Thanks, Alan.
Aaron, thanks very much, and thanks for your leadership. Let me now turn to Martin Van Trieste. Martin is the president and CEO of Civica. He has more than 35 years in the pharmaceutical industry in quality and manufacturing roles. He is the driver of everything we do, and he does this all without taking a salary. I can't resist mentioning. And Martin is going to walk us through in a little more detail the Civica Insulin Initiative and how we are going to make this a reality. Martin.
Yeah, it's, first, of course, I'm honored to be here today and with these other panelists and members of the congressional team, listening to patient stories like Aaron's and Dan's and Natalie's, just breaks your heart. And I can't say much more than what has already been said. So I'll just kind of bring it home and summarize, Civica is going to bring quality insulins at the lowest sustainable price to the market, which will be 85 to 90% lower than today's list price. And of course, that's the price that cash paying patients have to pay. As Dan mentioned, our pricing policy will enforce the maximum allowable retail price and will be transparent about it. And that means if someone tries to sell insulin for more than $30 a vial, we'll shut them down. We won't provide the insulin to them. And we want to make sure that our insulin is available to all Americans. It's not just available to Civica members, it'll be available to all Americans. And we're not just doing this alone, right? This is a collaborative effort with every corner of the diabetes ecosystem, from the diabetes community to philanthropists to health systems and to payers. So it's a big pull and a big push, but it's a big, strong bond that we all have together. And so with that, I'll turn it over to your questions.
Thank you, Martin, and thank you to all the panelists. We are getting some questions in the chat, and feel free to keep submitting those. One of the questions was, as we have said that the goal is to bring these products to market in early 2024. I don't think we've talked about where they'll be manufactured. And the question was, once they come to market, will it take time to ramp up production? So Martin, let me turn that to you.
So first, let me just say our facility will be in Petersburg, Virginia, and it will be operational in early 24, just in time for the insulin to come to the market. We'll have more than enough capacity to meet our expected demands and to serve a substantial portion of the total US insulin need. In addition, we have the ability to add additional capacity to the facility because we have extra space, or what we call a filling bay, and we'll use it to increase production as necessary.
Thank you. Another question that we received is, how does this fit with the context of the proposals that Congress is now considering around insulin, both in the Build Back Better legislation and in the Affordable Insulin Now Act? And so let me take moderator's prerogative as the policy guy to say, what Civica is doing is really complementary to what's being proposed in Congress. First of all, the legislation that Congress has proposed won't reach every American. In particular, the out-of-pocket caps don't affect people who don't have insurance. And so making low-cost insulin widely available is very important. There has been a lot of focus on the $35 copay limit in the proposed legislation. Less noticed has been that it's actually the lower of $35 or 25% of the negotiated price of insulin. So Civica won't have negotiated prices, we'll have one low transparent price. But if this legislation were to pass, it would still mean much lower out-of-pocket costs for many people. Potentially, say, a vial a month, 25% of $30. And so they're really complementary initiatives. Another question that we were asked that's closely related is, what can Congress do to support this initiative? And this really is a market-based solution. It can work on its own. I would note that in the Senate version of the Medicare price negotiation legislation, there's a provision that allows for a low-cost insulin that is marketed close to the cost of production, that allows that low-cost insulin to ensure that the benefits of that low cost get all the way even to folks who are uninsured. And so that low-cost insulin provision would be very valuable if that legislation moves forward. But let me also turn it to Dr. Kowalski for any additional comments on the role of Congress.
Well, JDRF certainly encourages Congress to proceed and pass provisions to cap insulin costs at $35 per month in Medicare and in commercial plans. We think this is, as you said, Alan, very complementary and very needed. And we could see significant improvements while we work with Civica to get these additional insulins out to the market.
Thank you. Another question that we have received is around both the form of the insulin will take. So will it be vials and pens? And also, are there limits to the quantities you can produce? So Martin, would you address that? I think you're on mute, Martin.
Yeah, we will be making vials and pens. We have enough production capacity to make enough vials for the entire market if that were to happen. We anticipate we'll get a market share of about 30%. And with that market share, we have enough capacity to make the pens. We'll use that extra space I talked about earlier to do that.
One of the questions that we received multiple times actually in the course of announcing this was, will the health plans play ball? Will they move away from the model of high cost insulins with large rebates? And Martin, would you share thinking on that?
No, it's a real good question. And we spent a lot of time as we've developed our models on how to address that. But first and foremost, I want to point out that 14 Blue Cross and Blue Shield health plans, along with their foundations, provided large donations to this initiative, along with Kaiser Permanente, Trinity Healthcare, and Intermountain Healthcare. And so that's a good sign that the insurance companies have bought into the model and to walking away from the rebates related to insulin in the marketplace and get those those savings directly to the patient. In addition, our retail operation, which we call Civica Script, will serve outpatient patients, consist of large payers other than the Blue Cross Blue Shields that represent around 100 million covered lives in the United States. And annually, they're required to submit a report back to Civica saying how they pass their cost savings on from Civica products to the patient. So we have that policing mechanism within our system. But also it's our hope that once insulin is available at this very low sustainable price, it will become politically impossible for any insurance company to charge the patients more than what Civica is charging, regardless of whether they adopt Civica insulin or not.
And then Martin, how widely do you expect it to be available? Which is really a question, I guess, of what will the distribution model look like? What pharmacies might it be in? Can you address that?
So like I said earlier, it'd be available to all Americans. We want to use every distribution channel. So traditional pharmacies, digital pharmacies, Walmart's, Costco's, Amazon's. We like to make sure that it's available through all those distribution channels.
And it's available to any pharmacy.
Any pharmacy.
Who's willing to abide by our pricing policy.
That's right. Any and all.
Great. Another question we received is around IP or patents. Do you expect any IP barriers that could prevent these from coming to market?
So we have done extensive due diligence around intellectual property and freedom to operate. We use well-known outside legal counsel to do that. But also that, when Mylan introduced Semglee, the first interchangeable insulin on the market for Lantus, they created a pretty nice roadmap on the intellectual property and the path forward. So we feel comfortable that we have freedom to operate here.
Great. Let me actually wrap us up with Natalie. I'm going to turn it back to you and just ask you that question of what could this initiative mean for people living with diabetes?
It would be life-changing. For me personally, it means that my daughter, who wants to grow up and draw cartoons and be a singer, that she can do so without having to think that I have to have a job that has insurance that will enable me to live and afford insulin. Right now, we tell her, you'll have to get a job that has insurance. Yes, you want to do all those things, but remember, you have to have a job that has insurance because you've got insulin. And that's her reality. As unfortunate as it is, I want her to have as much of a life of normalcy as possible. And so for insulin to cost more along the lines of a tank of gas as opposed to a utility bill, I think that will help and enable people to live more normal lives, to feel more free, and to sleep better at night.
Thank you. What a perfect way to wrap this up. Thank you to all the panelists. Thank you to everyone who attended today. If you have additional questions, folks on the Hill, you know how to find us. We have a website, civicainsulin.org, with a frequently asked questions section. And we are, any of us are glad to discuss this initiative more. So thank you very much.